We are here today with Dr. Jay Harness, renowned surgeon and breast cancer expert, serving as the principal investigator of the National Cancer Institute's Community Cancer Centers program at the St. Joseph Hospital Center for Cancer Prevention and Treatment in Orange, California. Today, we're going to talk about the physician's use of social media, specifically video, to improve the overall quality of care to patients. Dr. Harness has been practicing medicine for 36 years, is the past president of the American Society of Breast Surgeons and Breast Surgery International. Prior to arriving in Southern California, Dr. Harness spent 28 years in academic surgery at the University of Michigan, Tufts University, and the University of California. He is currently the clinical professor of surgery at the University of California, Irvine. Dr. Harness, it's an honor and a privilege to have you here today.
Well, Eric, it's a real pleasure to be with you, and thank you for your very kind introduction.
You are welcome. Don't speak too soon because I did some quick math here, and I know you started practicing in the mid-'70s, so that's before even cable television came about. So you've seen it all.
Yeah, I guess so. You're right. I finished my residency training in 1975.
There you go. And I wanted to start off here and ask you the question, in your observation, how is medicine evolving as a result of social media?
Well, I think it's evolving and changing a lot. And I think as a background piece of information, it would be important for me to share with my colleagues the fact that we're talking about exponential growth here. I went ahead and did some quick online research. Eric, it's just amazing. You're looking at Facebook, which you mentioned a minute ago, having 700 updates per second. That calculates out to around 60 million updates per day. Then you look at Twitter as another example, has 50 million tweets per day, or around 600 per second. And then when we look at Google, Yahoo, and Bing as search engines, none of us could have envisioned years ago that we're looking at, as an example on Google, 34,000 searches per second. That calculates out to close to 90 billion searches per month. And if you add up all the search engines together, we're looking at around 100 billion searches per month. I mean, these are just staggering numbers. And when you look at the graphs and the growth that has gone on, not only with search engine work, but then the growth of the social media, it's just really an amazing set of numbers. When you think about it, how have we passed the word along in the past? And one of the ways people have learned about our practices, or people in marketing know the value. What's the greatest value? Word of mouth. What's the new form of word of mouth? Social media. These kinds of numbers are just absolutely amazing. So, frankly, I don't think we've even begun to scratch the surface of what the impact of social media, search engines, all of these things are going to have on the practice of medicine. And I know that in my own practice, patients have Googled me at least 85 to 90% of the time before they show up. So the train has left the station in many ways for those of us outside of medicine when it comes to things like social media. My passion is in belief that we in medicine need to get on board and do so rather promptly.
It's great and very interesting. And I think in many ways, the patient benefit is clear, and patients are already gravitating to social media as a mechanism to help manage their health and address challenges that have come before them in their lives. How have you as a physician evolved by using social media tools?
Well, I've evolved. First of all, the number one tool is what we're using today. It's the webcam. And I'm having the opportunity to connect with you from here in Southern California to you in Boston using a high definition webcam. So it's a tool that we as physicians really need to get used to. The advent of not only this tool, but Skype as one of the ways of connecting over the internet, particularly where there's adequate bandwidth, really allowed the evolution of the social media show that you alluded to in the introduction, called Breast Cancer Answers. This has allowed me to respond to questions rather quickly. I'm connected to a colleague, a social media colleague, if you will, in Phoenix, Arizona. As questions come in, we process them. I'm able to give answers back that are not practicing medicine, but general enough to be able to hopefully respond to the needs of patients who are sending their questions in. The other fascinating thing, at least in my own practice, and as a pretty much full-time breast cancer surgeon, one of the things that I do, Eric, is I spend almost all day long answering questions. My ratio of talk time, if you will, to operative time is probably about 3 to 1. And the feedback that I'm getting from my own patients when they go to breastcanceranswers.com is that they feel like they're continuing the conversation with me. And this is going to be a very, very important thing I'm going to emphasize throughout our discussion today. What we're really talking about here is another way of continuing our relationships with our patients, or as I'll share with you in a few minutes, actually beginning the relationships with the patient before they ever arrive for their initial consultation. So the tools are going to continue to expand. Bandwidth is going to continue to expand. The technology of this kind of camera will expand. The audio connections, all of it's going to expand. So again, my plea is to my colleagues, please get on board.
And beyond just your patients who you're seeing, you are obviously reaching hundreds of thousands, if not 1 million patients outside of your practice. Help us understand, when you share content with those patients, when you're answering their answers, how are patients responding? What kind of feedback are you receiving?
Yeah, we're getting direct emails back saying thank you. They really appreciate, Eric, and this is really critical now, they appreciate the translation of medical information into layperson's information. Also, we try and keep our videos down to about 2 to 3 minutes. Occasionally they'll run as long as 5 minutes if they're really complicated, but we're trying to keep it in layman's terms so that, again, it's like, frankly, it's like if you were sitting right opposite me right now, it's the way I would be discussing things with you. As we talk to the video, we want to envision that what we've got is a human being right here, and that we're communicating one-on-one, face-to-face, if you will, believe it or not. And so the feedback has just been tremendous. In the little over 3 months that we have been up and operational, we've had over 1.3 million views of our videos on the internet. About 85% of these are here in the United States. The other 15% are overseas. I live and work in California. Well over 200,000 of those views have been right here in the state of California.
Wow, wow. I mean, let's kind of put on your fortune teller hat now and try predicting the future. I mean, how do you envision the future of medicine in social media?
Well, I think several things. The theme that I'm going to keep playing, the drum I'm going to keep beating, is the establishment of relationships with our patients. The word of mouth concept here, I think, is really important. A really good example of this, almost all of us have never met Oprah, have we? Yet from all the videos that we've seen of Oprah or the shows that we watch, we almost feel like we have a relationship with her. In other words, we think that we know her. The same thing, I think, is going to happen with physicians' interactions with patients, future patients. I've set up Breast Cancer Answers not as a way of having more patients come to me, but as a way of sharing information. But clearly there will be an impact on my practice. And there are ways, quite frankly, of targeting social media locally and regionally. So if the desire of a physician is to increase your presence in your local catchment area, this can be targeted and actually done with social media. As I said a little while ago, I don't think we've begun to scratch the surface. And quite frankly, I think the sky's the limit when it comes to social media, provided what? Provided that we get on board, provided that we as physicians become early adopters of this and that we're not left at the train station.
And how can social media as a collaborative platform, both whether it be between you and your peers, you and your patients, how can that specifically, that collaborative concept, progress medicine?
Oh yeah, no, I'm really excited about this. I think we're going to be talking faster second opinions, faster consultations. Think about it now. We can take pathology images, Eric, and digitize them very easily. Obviously, with digital X-rays, MRI, CT scans, all of these connecting into a PACS system can be done very easily. Quite frankly, for quick, what have we called them in the past? Curbside consultations with our colleagues. I envision that those curbside consultations, even if we're in the same building and a couple of floors apart, can be easily done using the internet connection, if you will, or setting up a designated social media platform just for us in a given building as a hypothetical. And that we can talk very rapidly with each other, very quickly with each other. We can share images on a split screen. We can do all sorts of things. I also envision, as an example, I run the breast tumor board every week. I can envision that we can do that virtual in the future and be, again, highly, highly effective at what we're doing. I think almost all care today is multidisciplinary at one level or another. So I think assembling the virtual multidisciplinary team can be easily done using a social media platform and communicating rapidly at set times. And then when you think about it, I think when it comes to sharing our knowledge overseas, I think this is going to be an outstanding platform as we go international with not only holding consultations internationally, but also, quite frankly, with sharing knowledge internationally.
That's really exciting. I know you know that Best Doctors is a global company, and we're actually just getting ready to roll out a collaborative platform that will enable our doctors to work with each other, just as you suggested, around path reports, around MRIs. So, just sort of as an aside, I'd love to have you check that out. And anyone watching today that wants to help us beta test that, we'd love to have you participate. So, with that, what advice would you give to physicians who are watching right now and who are considering applying social media to their own practice? And I know we didn't discuss this completely, but if you could touch upon not only some tactics that you would recommend, but also how you avoid any kind of legal concerns as it relates to being now a sort of a little bit of a YouTube rock star in the medical profession.
Well, thank you for that designation as a rock star. I'm just an ordinary person trying to do my thing here. I love the Nike ad. Just do it. Getting down to the legal implications, we are very, very strenuous in making sure that, first of all, we protect any questions that may come in. They're not shared with anybody. One of the things we do at Breast Cancer Answers, and frankly, I do it in my own practice, I have a form that lists 15 questions that you should have, that you should walk into your doctor's office with concerning your breast cancer diagnosis. Things like, what kind of cancer do I have? Is it in situ? Is it invasive? What are my markers, etc.? The next category, frankly, is about some treatment options, and the final category is asking questions about the doctor and the team that the doctor is involved with. So those are the kinds of things that I have. Actually, I've talked a little bit about not practicing medicine over the internet, at least in the format that we're in right now. I think a closed system could be a horse of a different color, but when I'm dealing and sharing information nationally and worldwide, again, I don't answer specific questions for specific cases, but try and give generalized enough answers that they're helpful. So just do it. Many of us as physicians can turn to our kids, quite frankly, because they're on the social media all the time. If you need help at home to get set up, do that. Get a Skype account or whatever is going to come down in the future. Get a high definition webcam. You can use the microphone on the webcam itself, which are quite good, or I happen to have a separate mic that I'm using today. Just sort of get into it, embrace it. Don't be afraid of it. And for goodness gracious, don't think that somehow it's going to go away, because it isn't.
Absolutely terrific insights, Dr. Harness. You are truly a pioneer in your space, so thank you very much. I want to thank everyone for watching today. Again, you're watching Best Doctors video series for physicians by physicians, and we hope to see you here on our channel in the very near future. Dr. Harness, thank you again. We hope to have you back.
Thank you very much, Eric. My privilege.